Hi, I'm Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. You got joint pain, numbness, and tingling. Who do you see? Your primary care doc, the orthopedist, or the neurologist? Well, today, we're gonna talk to you about why you should see a physiatrist, especially Dr. Marciello. So stay tuned. Okay, Dr. Mike, so we got patients coming in, they are complaining of joint pain, numbness or tingling, the viewing audience out there, not sure if they need to see their primary care doc or a specialist like an orthopedist or neurologist, but I always say it's a no-brainer. You should obviously call Maragal Medical and make an appointment with Dr. Marciello because you're a board-certified physiatrist. So why is a physiatrist such a great specialty to manage these complaints?
I think the thought here is really simplistic, is we want to get people back functioning. So physiatrists it's a short word for physical medicine and rehabilitation. So my specialty looks at all the different areas of breakdown that cause disability or impairments or difficulty doing things. Neurologically, you could have disabilities, musculoskeletal-wise for the joints, aspects of just health, poor cardiac conditioning, overweight, diabetes. All these things come into play relative why you can't walk down the street or go out in the yard or play some sports again. So physiatry looks at that in a conservative way, looks at it as a non-surgical way, and ways that we can manage pain and put it all together so we can get you back functioning.
Absolutely.
And that's what our specialty does.
That's great. And I think too, you think so outside the box. You did your training at Spalding in Boston. So I always tell patients too, hey, we got a Boston doc right here in Central Mass. And if you have any of those complaints, he can really think outside the box because number one, all of your clinical experience. And yeah, you can go the traditional route on the medical side, but you always throw that twist in because we're such a holistic minded practice. So when it comes to pain management or management of different conditions like arthritic change, we talk about those regenerative medicine injections. Whenever we do even like an intramuscular injection, we're looking at an option where we're using a natural substance versus a medication like cortisone. So really the advantages, I always say, as a private clinic, we have the advantage that the patient's not going to be rushed through a hurried exam. You're going to spend the time, and most importantly, at the end of the visit, the patient's going to have a thorough understanding of what their problem is, and then we bring them back and talk to them about a step-by-step plan of attack on how we're going to get them better.
Without question, and we think about options. So I can order the MRI or look at the person's MRI that already has been done. We can get new x-rays. I can prescribe the medications or maybe get rid of some medications, right, because I've done that in pain management before. The thought is we want to try to stay as holistic as possible, as natural as possible, use food and nutrition rather than a prescription if we can.
Yeah.
Use these injections because they're getting over a hump of a arthritic or a joint pain or a muscle pain, as you mentioned. That's because we want to look at you in the long term. We're not just treating you for now, come in 15 minutes, we treat the symptom, get you out and about. We're going to treat the symptom, but we're also going to put in perspective of looking at what's going to happen in a month, in a year, and a longer term. We want to keep it going for the long term, and it takes much more than 15 minutes for sure to start thinking about the larger scale recovery and functional improvement.
And then when you figure out the patient's problem, we're one-stop shop. So we got medical care, chiropractic treatment, and physical therapy all under one roof. So folks, if you're complaining of joint pain or of numbness and tingling, it really is a no-brainer. You need to call Maragal Medical and schedule an appointment with Dr. Marciello. We take most insurances, and we're looking forward to having you come into the clinic. So that's it for today. My name is Dr. Timothy Gallagher.
And Dr. Michael Marciello.
Have a great day, everyone.
See you in the clinic.